For so many people, the American Red Cross, they're there to help us in a disaster, but we don't think about them until the times that we need them. With us now, let's bring in Todd Coleman. He is the communications manager for the Michigan region of the American Red Cross. Todd, always great having you with us. How are you today?
I'm doing great, Ronnie. Thanks for having us on this morning. I appreciate that.
For so many people, I think American Red Cross, we see the commercials and we'll see the signs in the neighborhood. But really, until you've been in the need, in some of the situations, you don't think about what the American Red Cross does each and every day. Give us an overview of your organization.
Well, we serve all the communities that we are present in a variety of ways, Ronnie. You had mentioned disasters. For instance, here in Michigan, we've had a very active home fire season over the past year. So we are on the ground and we are assisting those folks who may be in an apartment complex or maybe just a single family residence that may have been having to flee from their homes due to a fire. So we do provide support at the scene. We will provide shelter, food and water. We also can provide mental health services for those who may request it, and also can help them with the paperwork and the guidance necessary for them to find a new place to live if that's the situation. Blood collection is another big part of the American Red Cross. We collect blood throughout the United States. Of course, we do here in Michigan as well, and that includes platelets as well. And the need for blood is constant, and that's something we always want to push out there. Every 2 seconds, somebody in the U.S. needs a blood transfusion. So it's the blood that's on the shelves now that helps in the event of an emergency later. As we head into the summer months, typically it's a challenging time for the American Red Cross to collect blood donations, and that's for a variety of reasons. Folks are enjoying this great Michigan weather in the summertime. Maybe they're heading up north, vacations, family get-togethers, that sort of thing. So oftentimes blood donation will kind of take a back seat to those summertime activities. And as you know, we've been in a pandemic for the past 14 months, and we're finally getting back to some normalcy. Vaccinations are rolling out, and we're people scheduling those appointments to be vaccinated. And so right now we're a little concerned about the impact that summer travel, that sort of thing, resuming normal activities during the summertime, how that may impact the blood supply as we head into the summertime. So at this point right now, we are certainly encouraging those folks who are eligible to schedule an appointment to donate, take that 1 hour out of your day and help save lives. Those are the two, I guess, high-profile things the Red Cross would do in a community. But we also offer training, CPR training. We have babysitter training, lifeguard training, that sort of thing. Also, we serve our armed forces. We have services of the armed forces where we assist families and military members in a variety of ways, be it a phone call, be it getting them letters or just getting them news on what's happening here in the United States if they are indeed overseas. So as you can see, we do serve the communities in a variety of ways, and it's all about our humanitarian effort that we do these things.
And we should point out that you do so much of that with the help of volunteers.
Yeah, we couldn't do our job without volunteers. I mean, they make up about 90% of our humanitarian effort, and there are always volunteer opportunities out there. And we encourage folks who maybe if they can't donate blood, maybe if they can't make a financial donation, they can help and volunteer in other ways, be it work at a blood drive, work the snack table, hand out juice to the blood donors after they get off the bed. We also have folks who actually will pick up and deliver some of our blood products to the hospitals that we serve. They could very well just be signing in folks at a blood drive, also assisting with our disaster relief operations in a number of ways. So we encourage folks to get involved if that's something that they're interested in. And again, it doesn't have to be a blood donation or a financial donation. It can be just as much as donating your time.
So with that, Todd, one thing that you mentioned, I'm curious about, how has the entire pandemic, when it comes to the blood supply and the need changed throughout this entire pandemic, because we do know in the beginning of the crisis, people were not driving as much. So maybe we didn't have as many car accidents. People were not having surgeries as much. Did that impact your blood levels? And now do you anticipate it's going to get back to pre-pandemic numbers with the return of, we hope, normal?
Yeah, when this pandemic hit, Ronnie, back in March of last year, I mean, it was new for everybody, and the Red Cross is included in that. We had to make a lot of changes to the way we operate and to the type of information that we were getting out to the public regarding blood donation. Obviously, as you mentioned, folks were a little nervous to maybe go out and drive around, and that, of course, impacted our blood drives because folks didn't want to gather where there were other people. And so it was ours from the get-go was to get the information out there that we put safety as a priority for all our blood drives, all of our blood donation centers. And we implemented a lot of safety precautions at every drive almost immediately when the pandemic hit. Things like checking the temperature of staff and blood donors before they come into the blood drive. Hand sanitizer stations throughout the blood drives for sure. Social distancing on the beds and when they're in the waiting area before they make that donation. And of course, face masks. We want people to wear face masks in our blood drives. That's including our staff. And if they don't have one, we certainly can provide one for them. So it was a little bit of a challenge, but we understood folks were a little concerned. So we made it a point to get that messaging out there that it is safe to donate. We've been working with the Michigan Department of Health and Human Services from the get-go to get that messaging out there that blood donation is critical to our communities. And even Governor Whitmer has donated a number of times during the pandemic to show that it is safe and we are following all those precautions. So our donor base has been fantastic. They have been coming out in droves since this pandemic began, and they were able to allow us to keep a healthy blood supply for those hospitals and patients that need it most.
So how is the supply level right now?
We're at adequate levels right now, but again, as we start heading into the summer months, we are seeing, we do a lot of blood drives at schools and at universities and colleges. And as you know, students are either working remotely or they'll be leaving campus very, very soon. So a lot of those blood drives may come off the books until fall again. So those opportunities are kind of lost. So it's even more important for those donors to find those blood donation opportunities in their community that do continue throughout the summertime. Because I mentioned, folks use a lot of vacation time during the summer. Students are away from classes, and we need every precious pint of blood that we can collect over summertime.
Todd Coleman with us here on the MegaCast. He's the communications manager for the Michigan region of the American Red Cross. And I would think as well, could it be a good sign for the American Red Cross hearing that offices are going to be able to start bringing employees back? Because I would think that you do a lot of blood drives at businesses as well.
Yeah, that was a real challenge for a good portion of the last year as well, Ronnie. We've, a lot of businesses working remotely, not letting anybody on their work campus, and that, of course, would affect whether or not we could continue hosting blood drives on those campuses. Our sponsors are very, very important to us. The businesses, the community centers, the churches that host these drives regularly, VFW halls throughout the state of Michigan as well. So we did. It was a real challenge to pick up those new sponsors who, again, much like our donors, were maybe a little bit leery about bringing in a blood drive into their place of business. But they've stepped up, and new blood drive sponsors have stepped up as well and joined forces with us to provide those opportunities for blood donors.
So, Todd, what is the process? Do you actually test the blood? Because we do know one thing about COVID-19. So many times people are asymptomatic. They don't know if they have COVID-19.
Yeah, well, we've been testing the blood donations for COVID-19 antibodies since last April. And that was a point where we were encouraging convalescent plasma donations, which, as you may know, was used to help those folks who were currently battling COVID, maybe in a hospital. That was used to make them feel better, basically. We are still testing all blood donations for antibodies, and especially those that may have high levels of those antibodies. They can still be utilized for convalescent plasma to help those folks who are battling COVID-19. As far as the actual blood testing, we test all of our blood products. They're collected at our donation centers, at the blood drives, taken to a testing facility, deemed safe, and then distributed to the hospitals that we serve.
Yeah, it's funny because, at the beginning of this, I remember there was so much of a conversation prior to the vaccine about the need for the plasma, but we're really not hearing much about that right now as well. So is it still needed and used?
Yeah, it is still needed and still used. And we had folks who, we had a lot of people come out to donate nationwide as far as the convalescent plasma. And again, those would be those folks who, tested positive for the antibodies. They had high enough levels to be able to come back with the American Red Cross and actually just make a convalescent plasma donation. However, right now we're testing all blood donations for those antibodies. And again, those with high levels may be used as as convalescent plasma to meet future needs for those patients.
We're talking with Todd Coleman. He's the communications manager for the Michigan region of the American Red Cross. And with that, Todd, how do people find out about some of the upcoming donation drives? Because they're not so widely advertised right now. We used to see them, on the side of the streets, at big facilities. Where are they tend to be happening right now?
Yeah, the best place for your viewers and listeners to find a blood donation opportunity is to go to our website, and that's redcrossblood.org. You can type in your zip code, and you can find a radius, if you will, a number of miles, however you determine that, as far as what blood drives are coming up. You can also make that blood donation appointment right on our website as well. We have a Red Cross blood donor app, and that's for a smartphone. It's a free download from that same website, redcrossblood.org. And again, it's a great resource to find open blood drives, schedule that appointment to donate. With the blood app, you can actually track your donations. You can challenge friends to donate and that sort of thing. And we say it puts the power to save lives right in the palm of your hand. And it's been a very, very popular application for smartphones. And then there's the old-fashioned way. If folks maybe aren't as computer savvy or smartphone savvy, they can use the telephone and call 1-800-RED Cross to make an appointment.
So with that, Todd, we know that the Red Cross is also a nonprofit. How are fundraising events going right now? A little challenging.
Yeah, it's been a little challenging, much like your job there, Ronnie. It's been a lot of remote type activity. We did do a lot with our marches, Red Cross Month. We also had a Heroes of March event in the Metro Detroit area. A lot of that was virtual. Obviously, all of our meetings are virtual. All of our interviews are virtual. But we've been plugging along. We are currently doing our Sound the Alarm campaign, which involves us encouraging folks to have a home fire escape plan and to make sure that they have working smoke detectors in their homes, and they're testing those smoke detectors monthly. Now, in a typical year, we would be out and about doing a lot of home visits, installing those for them, but things have been a little bit different now. We're still making those available to residents throughout communities, but we had to kind of get a little more creative in the way that we do those type of things. So we're real excited to be able to get back to some normalcy. A lot of our volunteers who maybe respond to like a disaster or something along those lines have found it a bit challenging and a little bit different because they're used to that face-to-face contact, be it speaking with someone who was affected by a home fire, comforting that person, that sort of thing. But a lot of it is done by phone or by a Skype or a Zoom or something along those lines. So it's all been challenging, but we've come through, as I think most of the United States has. We find ways to adapt, and I think that's the important thing, so we can continue our humanitarian mission.
So with that, Todd, too, any silver linings that maybe the Red Cross has discovered throughout the pandemic that you'll keep post-pandemic?
That's a really good question, Ronnie. I think our mission has always been the same, pre-pandemic and current pandemic, and even post-pandemic. I think, I think we're all excited to get back and to see those folks that we work with, to see those volunteers, to see those folks that we help. Home fire victims, victims of flooding, that sort of thing. And I've spent a lot of time at blood drives throughout my nearly 9 years at the Red Cross. And I've met a lot of blood donors, a lot of blood recipients, and that's kind of taken a little bit of a backseat. I don't get that one-on-one. And I think that's just what we're all kind of looking forward to. And I look forward to that day when we get that normalcy back, where we can start, being face to face with these folks, because it really is heartwarming to meet these people, talk to them about their blood donation story. Maybe they received blood at one time in their life. Maybe they were affected by a home fire and now they're volunteering because the Red Cross did so much for them. So I think that's kind of what we're looking for.
And do you find that is often the case, Todd? People received something from the Red Cross in some of these critical moments in their lives, and so they realize the value of what you do and what you offer, so therefore they feel the need to give back.
Yeah, I think that's not uncommon with blood donation, especially. That's something I always ask a blood donor or a platelet donor. I always ask them, what made you start donating blood? And it may have been a family member or a relative or that individual themselves that at one time needed blood products. Maybe they were in a horrific car crash. Maybe they had an organ transplant, which both those procedures utilize lots and lots of blood units. So they were impacted somehow by the American Red Cross, and they feel it's something they want to do as far as giving back and helping others, just like they received that help.
Todd Coleman with us here on the MegaCast. He's the communications manager for the Michigan region of the American Red Cross. And with that, Todd, anything maybe I didn't touch on that you want to share before we let you go today?
Yeah, we've got a really neat donor incentive going on throughout the month of May. For all those folks who come out to donate blood or platelets during the month of May, they'll be automatically entered to win a travel trailer camper, and that's powered by Suburban Propane. It's a Coachman Clipper travel camper, sleeps 5, ready to take friends out during the summer, and that's a really, really neat incentive, which we like to offer to our donors as a thank you, if you will, to coming out, donating, and helping save lives. But once again, 1-800-RED-CROSS is the phone number. You can go to redcrossblood.org, or you can get that Red Cross Blood Donor app, again, for your smartphone, and keep up on all the things blood-related, emergency-related, that sort of thing.
Well, Todd, we want to say thank you for your time, but also thank you for so much that you and your team do, and the volunteers as well for our community. I've been to so many fires and floods here in the region, and the American Red Cross always there on the front lines. So thank you to you and your teams. And we should note volunteers, I would imagine, Todd, are still always needed as well.
Volunteers are always needed, and I can't say enough about our volunteer base. Again, we couldn't do what we do without them. So big kudos to them, and thank you very much, Ronnie, for having us on to talk this morning. I do appreciate that.